Hello, everyone, and welcome for tonight's webinar. I'm so delighted that you could be here, and I'm delighted that I get to be part of our discussion tonight. I'm Elaine Murato, the founding dean of the Loyola's Parkinson School of Health Sciences and Public Health, and I'm delighted to be the moderator for tonight's panel discussion. Thought it might be helpful to introduce myself and share a little bit. I joined Loyola in February, and you might say just in time for the pandemic. I'm trained in epidemiology, which you've read a lot about in the news, but it's the study of the distribution of disease and causes of disease, board certified in public health, and I advise the FDA. You know, the Parkinson School has expertise in epidemiology and emergency planning, and I'm proud to be part of the faculty there, leading efforts in Chicago's Cook County to expand the reach of COVID-19 testing, contact tracing, and surveillance, really, to address health equity gaps that we see in our neighboring communities. And I've been a really strong advocate for how we leverage our cross-disciplinary expertise and partnerships, both internal and external to Loyola, in ensuring our collective resiliency as we respond to this COVID-19 pandemic. So with that background, I want you to really know that Loyola is actively staying on top of the evolving federal, state, and local public health guidance, tracking key epidemic indicators here in our Chicago region, but also nationally, as we know many of you may be residing right now in different parts of the country. And we're learning and adapting best practices from how other universities implemented back to school in the fall when they brought students back to campus. So we're very fortunate to have the faculty expertise, not only in the school of the Parkinson School, but also in other schools of medicine, nursing, business, so that we all can collectively synthesize this rapidly evolving knowledge and really inform Loyola's logistics planning and health safety planning. Actually, this is what academic public health practice is all about. So Loyola is hosting a series of webinars for you, our Loyola community, about our limited return to campus this spring. And by return to campus, what we mean is expanded gradual reopening. We've been on campus, and now we're ready to open residence halls and expand that experience as we go into the spring. We hosted the first webinar prior to Thanksgiving to provide an overview of our spring plans, and subsequent sessions are planned to address specific topics. So tonight's focus is on health, wellness, and testing. Future webinars will address academic questions, residence life, and the student experience. I want you to also know that Loyola is hosting separate webinars for our faculty and our staff, and we're all in this together as one Loyola to be safely operating. You'll be able to reference slides from tonight and these other webinars after the show for more information. Today we have about 1,500 participants registered, and we're really deeply grateful for your interest and participation tonight on a weekend. We have a mixed audience, we know, of undergraduate and graduate students, families, faculty, and others. And our discussion, though, will be student experience focused, but we know the information is relevant for all of us. Again, as we say, return to campus, it's really a continual gradual reopening of our campus. And tonight we'll be hearing from Loyola leaders about health, wellness, and testing for the spring, and how that will work to keep both our students, faculty, staff, and our entire community safe for the spring and beyond. So specifically, we will address the following: Loyola's COVID-19 test plans and procedures, our testing compliance and accountability, our physical health services, as well as, and importantly, our mental and emotional health support. So without further ado, please join me in welcoming our panel members. We'll have Dr. Joan Holden, the director of the Loyola Wellness Center, as well as our university's health safety officer, David DeBoer, the director of counseling for the Loyola Wellness Center, Mary Duckett, our senior program coordinator at the Wellness Center, Kana Hanning, who is the associate vice president for facilities at the university, Mira Kravoche, who's the Assistant Director of Health Promotion at the Wellness Center, Rahimi Siddiqui, who's our Chief Health and Wellness Officer and Student Government Representative as the Student Government of Loyola University Chicago. So we have an excellent panel here. After each speaker discusses a topic, there will be an opportunity for question and answer. Questions have already been gleaned from those that you sent in, and we'll be discussing some of those live with our panelists. We also encourage you to submit questions in real time via the question and answer function, where you'll be directed to one of our experts in the wings on either on the panel or experts in the wings who will be able to respond via the Q&A session as well. Our experts in the wings include faculty and staff from departments across all 3 of our campuses. There's representation from our Wellness Center, from our Provost Office, from Management Policy and Command Team, which was created in response to the pandemic, our University Marketing Communications, Dean's Office, Facilities, the Wellness Center, Residence Life, as well as fellow colleague epidemiologists from my own school. We expect that we will conclude the webinar somewhere around shortly after 7 o'clock tonight, Eastern time, or excuse me, Central Time. Our Q&A experts will remain online to provide some written replies to any of the remaining questions that come in. We will also be sharing web links for you live as we go along. And finally, this event is being recorded and will be posted to the Return to Campus website for further reference later this week. Our goal really is that you walk away with your questions answered about Loyola's plans for testing and wellness for the return to spring, and that you gain the knowledge that you need to feel confident in your own decision making. So we hope that you find the evening helpful and informative. So without further ado, I'm going to turn it over now to Dr. Joan Holden, who directs our Loyola Wellness Center and is our university's health safety officer, and Kana Henning, our Associate Vice President of Facilities. They'll be talking first about testing, contact tracing, quarantine, and isolation. I'll turn it over to you now, Joan and Kana.
Thank you, Dr. Morato, and good evening, everyone. My name is Joan Holden, and I am the Director of the Wellness Center, and I also serve as the Health Officer for the Management Policy and Command Team for Loyola's response to the pandemic. And I am delighted to be with you here tonight to discuss in more detail the testing strategy we have put forth for spring semester. I would also like to say that the safety and well-being of our campus community is always our first priority. As mentioned before, we do reserve the right to postpone our move-in plans should the conditions of our surrounding community make it medically unadvisable. However, we think we can do this safely and are excited to share with you our plans. A few words on COVID in general. The most fundamental aspect of managing this pandemic is preventing getting the virus and preventing the transmission of the virus. Transmission occurs mainly through droplets and sometimes through aerosols. And transmission can happen 2 to 3 days before a person becomes symptomatic. As much as 83 to 99% of people with COVID have fever, and 81% have mild symptoms. Those who recover may have lingering symptoms such as fatigue. The treatments for COVID have evolved significantly since the pandemic began, and now we can look forward to vaccines, which we anticipate to become available to select populations by the end of the month. We do not expect to have a vaccine available here at Loyola soon, which further substantiates the need for the rigorous testing program that we plan. I would also like to share with you that the Wellness Center staff has been doing testing for COVID since August. We have continued to see students living in the surrounding community and employed a targeted testing strategy for high-risk groups, but we have not, until now, had widespread scale to our testing capabilities. And now I'd like to give it to Kana for a moment.
Good evening, everyone. My name is Kana Henning, and I am responsible for campus continuity and operations plans within our emergency response structure. University leadership has been studying for months now the safest way to bring more of our students back to campus in the spring and to be able to reopen our residence halls, albeit at a reduced density. We have been watching what other schools who have reopened their universities to greater capacity have done. And we know that with good execution of 2 key areas, cases and outbreaks of COVID-19 can be managed. We know that those 2 areas are 1, aggressive testing of asymptomatic students, faculty, and staff, and 2, compliance with mask wearing, distancing, and all of our other personal safety practices that we've been communicating regularly. So with this in mind, we decided to implement a surveillance testing program at Loyola, which is critical to our ability to reopen.
A few words about surveillance testing in general. According to the Centers for Disease Control and Prevention, testing of asymptomatic students, faculty, and staff should increase the timeliness of outbreak detection and response by rapidly identifying and isolating COVID-19 cases that would have otherwise gone undetected without testing. We have agreed to a community partnership with Shield, Illinois. Shield, Illinois is a screening, testing program and infrastructure that deploys the University of Illinois' innovative saliva test across the state. The benefits of using this test are that it is less expensive, has a 24-hour turnaround time, enables us to provide scale in our testing capability, is easy to use, and is highly accurate. Another benefit of using a saliva-based test is that it can identify virus in the asymptomatic person, thereby helping us to mitigate spread in a more expeditious manner. In addition, the saliva-based test is free. Each undergraduate student will be asked to test twice a week. Graduate students, faculty, and staff will be asked to test once per week. If you do not plan to visit campus at all in the spring 2021 semester, you will not need testing and you do not need to complete the consent form. This is true for all faculty and staff and students. However, if your plans change and you must come to campus, we ask you to submit to testing the day you plan to enter a campus building. To be more specific, if you plan to come to campus less than once a week or only sporadically, you should submit for testing upon arrival each time you visit campus. Although results will not be available for 24 hours, positive cases will initiate contact tracing to determine any potential contacts you may have had while on campus. If you come to campus once a week, you should submit for testing upon arrival each time you visit campus. Undergraduates who plan to be on campus regularly in the spring should plan to submit for testing twice a week with 1 day between tests. Faculty and staff who plan to be on campus regularly in the spring still only need to submit to once per week testing. Finally, if you will be entirely off campus in the spring and you will not be coming to any of Loyola's 3 campuses, you will not need to test and you will not need to sign the consent form. Testing will be available 7 days a week on all 3 of our campuses. Please do visit our on-campus testing page on the Return to Campus website for even more information.
We have modified our compliance strategy slightly, so I wanted to provide you with an update from our previous testing announcement that went out right before Thanksgiving. First, and most importantly, we will no longer require re-entry testing. Our testing sites will be open the week of January 11th, so we do encourage you to begin visiting our testing sites that week. However, it is not mandatory. Throughout the semester, we will manage our compliance by monitoring who's on campus and how frequently they're accessing our campus buildings, and ensuring that it's those individuals are testing at the frequency that Joan just described. In the event that we find someone is not testing but is still accessing campus, we will follow up with you to remind you of the importance of our testing program and the need to test. If you still do not comply with testing, we will remove your ability to access campus buildings until you become compliant. For our residential students, though, I want you to rest assured you will never lose access to your residence hall that you were assigned to. That will always be maintained. To be eligible to receive your first COVID-19 saliva-based test, you'll need to complete a few steps. First, you need to make sure that you've completed your COVID-19 prevention and awareness training via Get Inclusive, and Mary Duckett will speak to that a little bit later in the webinar. Read and sign your consent forms. Those were sent out to you on the 23rd of November, and you've likely received a few reminders by now. We do need those consent forms back because that helps us create the roster of people who will be tested, and it also helps us better understand our testing volumes. After signing your consent form, you'll receive an email with instructions for creating your MyShield account. And we expect that this email will come out to you sometime after the new year. It'll allow you to schedule your visit to the testing sites, and it's the portal through which you'll also receive your test results. So that means that everyone who is tested, regardless of frequency, does need their MyShield account. For more detailed information about our testing process, including scheduling your visit, arriving for your test, the check-in process and what to expect there, and the locations of hours of operations, please visit our on-campus testing page of the Return to Campus website. So up to this point, Joan and I have given you a lot of background information and provided you with what you need to prepare for testing. But the rest of our time we'll spend talking about testing, contact tracing, quarantine, and isolation from start to finish. We will have testing sites located at all 3 of our Chicagoland campuses. And at those sites, you'll check in with a collection assistant who will locate your scheduled visit and provide you with a vial for depositing your saliva sample. You'll be asked to move into a designated spot where you'll drool into your vial, and then you will proceed to the exit where you'll deposit your vial into a rack before leaving. This process should take approximately 5 minutes total. It should not take a large chunk of your day. And I also want to reinforce that the cost of the testing is free. You will receive the results of your test within 24 hours in your MyShield account. If you test positive, you will receive a call from a contact tracer to begin the contact tracing process. And Joan will now describe what that process looks like.
Loyola has hired several contact tracing team leaders that manage a team of volunteer contact tracers that serve our Loyola community. We have been doing contact tracing since August and have an established system already in place. When students, faculty, staff test positive for COVID, we ask that they report the positive case to COVID-19 report at luc.edu. Students in the testing and surveillance program should also report their positive case. And we will be able to identify positive cases and will follow up should a student, faculty, or staff fail to report. Once a case is reported to the email, a case investigation begins. Contact tracers will reach out to the infected person to determine contacts, and if necessary, will reach out to close contacts to ask them to quarantine. All of the contact tracers have gone through a certification process as well as HIPAA training. At no time does a contact tracer ever give personal identifying information about the infected person to potential contacts. When the contact person reaches out to infected individuals, it's also very important for students, faculty, and staff to return the phone call in order to keep our community safe. I'd like to talk a little bit about the care of our students who have COVID, who are in isolation or quarantine. I know this is on everyone's mind. First, a definition of terms. Move-in quarantine is what we're talking about when our students come back to the residence halls. We understand that the CDC recommendations recently changed and are studying this new guidance and the Chicago Department of Public Health's interpretation of that guidance. For now, our current plan remains to be the same for students living in the residence hall to quarantine for 14 days, the first 14 days. In fact, the CDC says that 14 days is still the safest procedure. As throughout the pandemic, we know things are subject to change, and we will definitely communicate any shift as soon as possible. Students in move-in quarantine will be permitted to do their laundry, take out their trash, and visit the building lobby to pick up meals. Exposure quarantine is different than move-in quarantine. These are people who have had a known exposure to a person with COVID as identified through a contact tracer. These individuals also need to quarantine, but during exposure quarantine, a student may not leave their room for any reason, with the exception for medical care. They too get tested between days 5 and 9. Isolation is a term used for people who have been infected or diagnosed with COVID. The duration of isolation is 10 days, and testing to leave isolation early is not an option.
So for our residential students and parents who are participating in our webinar, I just wanted to let you know that we do have an upcoming webinar on December 16th which will provide you with much greater detail about our spring plans for the residence halls. And you've also probably received your housing assignment letter from Residence Life with additional details about how to plan for the spring semester. For students who are living in a unit with a private bathroom, you will be permitted to quarantine in place and isolate in place if needed. For students living in a unit with a shared bathroom, you will be moved to a quarantine hall. And I only mean that for exposure quarantine, not for move-in quarantine. For your initial move-in quarantine, you will begin in your assigned room. But if you are to become exposed and need to be in quarantine for that purpose, you would be required to move to a quarantine hall. And for those students who are living in a unit with a shared bathroom and come down sick with COVID, they would be required to move to an isolation hall. Students who are living in a unit with a private kitchen will be provided with a meal kit for the period of quarantine or isolation. And students who are living in a unit without a kitchen will have their meals delivered to them. You'll be able to specify your dietary restrictions or any allergies, and meals will consist of both hot and cold meals. And all of that link should have been provided to you as well on Friday afternoon.
I'd like to finish up our section here by talking a little bit about COVID care coordinators. The contact tracing team leads share additional responsibilities as COVID care coordinators. The coordinator team leads will not only be initiating case investigations, but they'll also be working to support students in isolation and quarantine, making sure that their needs are met and connecting them, if appropriate, with wellness center medical professionals. Contact tracers will provide students both on and off campus who are in quarantine due to exposure or isolation due to a positive case the phone number of COVID care coordinators, which students can call should issues arise. In addition, all students in isolation or quarantine will have access to the wellness center through telemedicine, as well as access to the Dial a Nurse telephone triage line. Thank you.
Thank you.
Dr. Morado?
Yes, coming back on. Thank you very much. So before we start our question, what I hear you saying is some very careful thought as a continuation of gradual reopening. I was looking at some of the questions coming in, and I think it's important to underscore that Loyola has been open on some of its campuses. We have had some courses taught in a lab-based in-person. We have graduate students on some of our campuses continuing to do research in facilities, and that we've learned a lot from that. But really what we're talking about is reopening in the spring, some expanded residence hall, albeit single occupancy and de-densified, and a continual gradual reopening. Nonetheless, I thought it might be useful before we get into some of the nitty-gritty details of questions people submitted to just hear your reflections, Joan and Kana, on what I might say is an elephant in the room. You know, we all hear in the news right now, cases are surging nationally, locally. Various political government agencies are changing recommendations in that. Why is it you and we at Loyola feel comfortable with our gradual reopening plan?
I'm happy to start. Thank you, Dr. Morado. So we understand obviously the conditions that we would be planning to reopen under, and we don't take that lightly. We understand that everybody is nervous and concerned, and rightly so. We also have been studying what other universities have done that have permitted them to remain open in the fall semester, and to do so with incredibly low positivity rates within their campus community. And the ability to widely test your entire community and identify cases before they are allowed to be transmitted and create outbreaks on the campus have certainly has been the one of, if not the most important functions that we have in order to be able to reopen. So we are excited that we have been able to forge this partnership with Shield, Illinois, and to be able to bring this testing program to the university. we go into this clear-eyed. We also know that universities that have opened see spikes at the beginning of their reopening. And we can anticipate that that could happen on our campus. And if that does, we know that we have certain levers that we can pull that can help mitigate and contain the spread on our campus. And some of those could look like taking all of our classes virtually for a period of time, or really being able to hone in or focus our testing on one particular residence hall or cohort that seems to have an outbreak occurring in it. We would actually have the ability to more closely target that population of people. So we feel comfortable that this will help us in the spring semester.
Yeah. Dr. Holden, is there anything you'd like to add?
The only thing I could add to that, and Keenan mentioned it briefly, is about positivity rates in campuses. The positivity rates in campuses that employ the multifactorial strategy that we plan to employ are often most commonly lower than the community positivity rates. So we know that the strategies that we are going forward with the broad scale testing and social distancing measures that will be put in place, we know that that has been working by looking at other universities.
Yeah.
Again, we go in it clear-eyed, as Kane said, and we are aware that we are at the height of the pandemic now. But we feel confident that we can try to do this.
I feel confident as well in what you're saying. So with the time we have, maybe we pulled out one or two of the most popular questions or common questions, I should say. Maybe I can ask one. If I only visit campus periodically, do I need to get tested every week? Will I still be able to access campus buildings? Kana, what do you say to that?
Sure. So the underlying philosophy of our testing program is, if you're coming to campus, test. If you're not coming to campus, don't worry about it. So if you are planning to be on campus, we are going to want you to test on the day you come, even if it's just once a semester to pick up a book, or a handful of times a semester to do some research in the library. We need you to be on campus, or we need you to test for the reason that Joan mentioned, and that is it allows us to commence contact tracing immediately after, if by chance at the time that you were on campus, you were positive and you engaged with other Loyalans on campus. But we really just want to keep it to pretty simple. If you're coming to campus, test on the day you come. You don't need to come specifically just to test. Just visit one of the sites whenever you come to campus.
Yeah, that's good to know. Dr. Holden, what if I've had coronavirus already? Do I still need to submit for testing?
A very good question. And after consultation with Loyola's professors of infectious diseases, the data is not clear about the level of immunity with antibodies after COVID infection, or for how long. For that reason, we are asking that people with prior infection with COVID remain in the planned testing regime. However, people who have tested positive in the prior 3 months before the start of the semester should be removed from the testing regime, and people who fall into this category will be provided an exemption.
Okay, last question then. What am I allowed to do while in quarantine? Can I go out for walks outside?
So I'll go ahead and I'll take this one. If you are in what we're calling move-in quarantine, those you will be permitted to move within the building within reason. You will be permitted to do your laundry, go grab your meals from the lobby of the building. Unfortunately, during exposure quarantine, you will not be permitted to do any of those activities. You will have to stay within your room. And also, unfortunately, during both of those instances of quarantine, you would not be permitted to walk outside. We will be asking, though, our students who are in move-in quarantine during those first 2 weeks of move-in to visit our testing sites. So they will be permitted to leave, go to the testing site, get tested, and then come back to their rooms. So we're really encouraging you to visit Student Activities and Greek Affairs website, find out what type of activities they have going on virtually to help you remain connected to the community. Check out what's going on in Hallis Recreation Center. There's some great online or virtual exercise classes that you could take to help stay active while you're in quarantine and to help you again remain connected with the rest of the university.
Yeah, great. What a wonderful transition to our next topic, which will be on mental health and wellness and what the university is doing to make sure all students are feeling supported in that regard. But thank you, Kana and Joan, very much for the information you provided. For those listening, you make sure to visit the Return to Campus website if you're looking for more information. And now I'd like to welcome Dr. David DeBoer, who's the Director of Counseling, to provide some more information on mental health and wellness. Thank you.
Thanks, Dr. Murato. Thanks, Dr. Murato. At this point in your Loyola career, you've probably heard a lot of talk about cura personalis, or care for the whole person. And we're all here tonight because this value is really a part of what makes a Loyola experience so distinctive. At the Wellness Center, we know that students can't be effective students or learners if they don't first attend to the many aspects of personal health and wellness. And we also know that the unique challenges of COVID have made self-care and wellness both more challenging and more important than ever before. The medical pandemic has brought with it significant mental health distress as well. Certainly, there probably isn't a person on this webinar tonight who hasn't experienced some kind of pandemic fatigue. Thankfully, we can now see an end in sight, but we know we all have a long winter yet ahead of us. Even in the midst of this pandemic, Wellness Center mental health professionals have continued to support the emotional and mental well-being of our students. Our counseling staff includes psychologists, social workers, counselors, and a psychiatrist. We provide a range of services, including mental health assessment, time-limited individual counseling, group therapy and one-time workshops, psychiatric medication services, care management and referral services, crisis evaluation and response, including after-hours response. We're proud to have counseling staff from diverse identities and backgrounds. We also have staff members who can provide counseling in Spanish, Mandarin, Cantonese, and German. Because we're funded by the student activities fee, which has again been waived for this semester, there are no costs associated with counseling visits. Your records with us are also strictly confidential. They're separate from your educational records and protected by medical privacy laws. Only you can authorize their disclosure or release. It's very easy to schedule a counseling visit. Our website is luc.edu/wellness. If you click on the Make an Appointment tab, you can even schedule an initial appointment online. You can also call to schedule an appointment. You can reach us at 773-508-2530, pressing option 3 to speak to or leave a message with a counselor. This may be a good number to keep in your phone, so I'm going to repeat it. It's 773-508-2530, pressing option 3. For routine counseling, the first visit is always a 30-minute phone call where a counselor will ask you a number of questions to learn about your unique situation and needs. They'll then make a recommendation for the best next steps in your care, which might include any combination of the services I named above. During the pandemic, all our services have continued remotely via telehealth. And as we've been doing this fall semester, we'll continue to provide mental health and counseling services online. Every year, some of our students do experience more acute mental health crises, and we remain prepared to assist with those as well. Please know that in addition to being able to meet remotely with one of our staff on an urgent basis when the Wellness Center is open via telehealth, students experiencing this kind of crisis also have the support of an after-hours counselor 24 hours a day, 7 days a week, all year. This after-hours counselor can be reached by calling the same number I noted above. And on our website, you'll also find a link to a crisis text line. It's important to note that for legal reasons having to do with professional licensure laws and the patchwork of unique differences in laws among the states, Some of our telehealth services are only available for students currently living in Illinois. These include brief individual therapy, psychiatry care, and some of our therapy groups. While some of our treatment groups are only open to Illinois residents, many of them are support spaces that remain open to you even if you're living out of state. Because we know that opportunities for peer-to-peer connection are so much more limited in this environment, we're offering more groups this year than we ever have. We know that however, that many students are initially hesitant to consider groups. It feels risky or vulnerable and a little bit scary. And we want to encourage you to challenge yourself to go beyond your comfort zone. Year in and year out, we hear feedback from students that they were glad that they did challenge themselves. Also, psychological research bears out what many of us know from experience, and that is that people who take, or when we take an active approach versus a passive approach to our struggles, we end up coping better and feeling better. So we urge you to actively seek out help and support. Please don't wait for it to come to you. One way to do that is to take advantage of many opportunities for virtual connection that our campus partners are offering, and my health promotion colleagues are going to share what some of those are in a few minutes. Another way you can seek connection and support is to take advantage of individual counseling at the Wellness Center and also group counseling. We're offering a wide range of groups. They include general therapy groups, a graduate student interpersonal process group, an emotional intelligence and relationships group, a healthy self-image group. We offer some groups specifically on adjustment, coping, and stress, including 3 mindfulness meditation groups, an anxiety management group, a 3-week stress management skills group. We're offering for the first time this semester a group for students for help with divided attention and procrastination. If you're feeling stuck with online learning, we're calling it Distraction Action. We're basing that on a lot of feedback we're hearing from students of the struggles they're having with online learning. And so this is one way we're trying to support students to help with that. We have a group for graduating seniors transitioning and looking for support about how to manage next steps. Graduate students have a dissertation and thesis support group available for them. And then many of our groups are also identity or affinity-based support groups. We have a group of Latinx identified student support, Black student support group for both undergrad and grad students. We have a support group for students who are part of the LGBTQ community on campus, and a group for international student support. If you are one of those people who, for whatever reason, can't commit to a weekly group, we're offering some single session workshops, including one called COVID Party of One, which helps focus specifically on how to stay healthy and well and connected during a period of relative isolation. You can find out more about our groups and workshops on the group counseling button under the mental health tab of the Wellness Center. There you'll also find a detailed description of the group, instructions on the day and time, and how you would become a part of the group. It's also important to note that whatever state you're living in, we encourage you to schedule an initial visit with a counselor if you're considering counseling. We can then speak with you about your unique situation and needs, let you know what Wellness Center groups or workshops might be right for you, and also make recommendations and guide you to the best way to access additional services and resources in your home state. We call this service care management. Please also check out all the other resources on our website. They include online self-assessment tools, as well as an array of wellness-related topics, along with apps for things like guided meditation. It's also important to learn about your health insurance and what services that covers. We can help you with that, but we also encourage families to learn more about your insurance coverage and what resources are available. For example, those who have the United Behavioral Health Student Health Plan, UBH, they offer a service called BetterHelp, which provides longer-term ongoing contact via telehealth on either a texting or a video platform without any additional charge for members. It's possible your insurance company offers something similar. What I've discussed so far are services for students at our Lakeshore and Water Tower campuses. If you're a student who's enrolled in one of our programs at the Health Sciences campus in Maywood, mental health and counseling services are offered through a program called Perspectives, and they offer a similar roster of services on that campus. and also on a telehealth platform during COVID. Finally, I just want to reiterate what I shared in a similar webinar this summer, and that is that many of us are likely to remember this historic and extraordinary year as among the most stressful and challenging times in our life, as persons, families, and as a society, and certainly as a university. An opportunity that's hidden in moments of crisis is the chance for us to discover the depths of our own individual strength, but also to find our collective strength in coming together to support each other and to build each other up as a community. We've already been doing that and finding a lot of resilience as students and staff and faculty have been rising to the occasion of this challenge. And the spirits of team can-do spirit is what Loyola and the Wellness Center have always been about. And we're committed to supporting each of you as together we find our way through the end of this pandemic. Thank you.
Thank you, David. Very reassuring words. It's very good to hear the attention that Loyola is taking, not only to everyone's physical safety and screening and testing, but also the mental health as well. And really having a self-care plan is a great strategy, whether we're in a pandemic or not. It's really important that we think of this in a preventive way, as you're saying. So I'm noticing that we have now just reached 150 questions answered in the Q&A. Please keep them coming in. Our team is actively working to answer your questions. We may run later than originally thought, but that's okay because we want to make sure your questions are answered. So David, I think we have time for maybe two that we had planned. One being, we heard from Kana that when you're in quarantine, you can't go for a walk. I know for me, that's part of my mental health wellness. So what opportunities is Loyola planning for that you see for connection and support during this mandatory quarantine period?
Well, I'm glad you mentioned having a self-care plan, because I think anticipation and planning and prevention is really key, and knowing what your options are and what your strategy is going to be during that 2-week period of move-in quarantine is really important. So map it out for yourself. Who are you going to connect and how are you going to connect with them? Who are you going to connect with? And if exercise is your thing, what can you arrange to do in your room by way of whether that's a yoga practice or some kind of calisthenics or exercises within your room, as Kana said, mentioning Hallis. If counseling is something that's important to you, you can reach out for individual counseling. We're also, keep your eye on our website, because we're going to be planning a couple 30-minute mindfulness meditation opportunities during that move-in quarantine week. So that's a chance to kind of connect in a group format, and if that's something that is helpful for you in terms of mindfulness meditation as a stress management tool. So those are a couple thoughts.
Yeah, that's great. And I know we'll hear more in the next section, or health promotion as well, and ministry services. So that's great. My other question is, okay, who should I reach out to if I'm a parent or a family member and I'm concerned that my son or daughter is having a tough time and maybe experiencing a mental health crisis or emergency? What should I be doing?
Sure, excellent question. If you for some reason have concern about the immediate personal safety of your student, please call campus safety right away, and you can request a well-being check if you have reason to think this is a mental health emergency. You'll be learning more in the Residence Life webinar about what their protocols are, about how to contact them and how Residence Life can support your students. So I encourage you to check in at the Residence Life webinar. In less emergent situations, if you're concerned about your student and being isolated or in particular distress, one thing I encourage you to do is to reach out to the Dean of Students office. They're at the Center for Student Assistance and Advocacy. Their website is luc.edu/CSAA, and their contact information is there. And you can express your concerns to the Dean of Students, and they can notify appropriate campus personnel and do outreach based on the situation of what's going on with your student.
Yeah. And just to build on what you said earlier, figuring out a family plan is important as well. So I know with my own kids, just even talking about how are we going to stay communicating in touch and figuring out your own personal plan is helpful too, as we kind of go into this together. So thank you very much for your time, David, and the words of wisdom that you shared. Our next section is going to build on that, and we're going to be hearing two folks talking about what Loyola is doing to promote health and wellness, as well as additional resources that are available. So it's my pleasure to invite now Mary Duckett, who's the Senior Program Coordinator and Special AOD Specialist at Loyola Wellness Center, as well as Mira Gravoche, who's the Assistant Director of Health Promotion within the Wellness Center, to give us some brief remarks. Mira and Mary, it's on for you now.
Good evening. Thank you so much. I am delighted to be able to speak to you tonight all about health promotion. So the goal of health promotion is really to create environments and systems that enable students to optimize their well-being. And we do so by emphasizing prevention opportunities and response services. David has spoken briefly about what we offer in terms of students for their mental health. I want to offer just a couple of things that are upcoming for our students. So just this Wednesday, on Wednesday, December 9th, is what's known as Study Day. And Study Day is when you get a break from studying for finals and you get time to catch up if you've got some more studying to do. But our team has always offered additional activities on that day. So this Wednesday, we're going to be teaming up with Campus Recreation to do a yoga class. We're going to be working with the libraries to offering some crafting classes. Our student counselors within the Wellness Center are going to be helping build those coping toolkits. So if you feel like you need some additional help getting those tools together before the start of the semester, this is a great opportunity. And Mary's going to speak more specifically around how to get in touch with us and how to stay abreast of all of our different offerings. In January, in anticipation of students coming back to campus or coming back to the area, we're going to be offering 2 Instagram live Q&As. So on our Instagram channel, we're going to be having a conversation, one with our medical professionals who are able to answer questions live about all of the medical services that we provide within the Wellness Center, and then mental health Q&A. So one of our mental health staff, actually David, will be the one on our Instagram who will be asking questions live from students coming in. These are just a few of what we will be doing, but the whole division of student development is teaming together to make sure that our students are well connected and have tons of opportunities to get involved. So our student activities and Greek affairs will be hosting an organizational fair on January 21st. All this information will be forthcoming. You don't have to memorize it. But one of the best ways to stay connected and offset loneliness is to join a student organization. Sorority and fraternity life will be doing recruitment in the spring, so you can follow them on Instagram. And Lou Community, if you're not already familiar, Lou Community is the best way to find upcoming events, RSVP for things that are interesting to you, search a calendar by interest or by date, and you can see the whole myriad of events that our university is offering. I know that Residence Life is going to be offering a webinar soon, but know that the staff of Residence Life is going to be making those one-on-one connections with your students living in the residence hall. They're not going to be moving in and then just expected to fend for themselves. Our resident advisors are going to be there to make sure that your students get a little bit of one-on-one personal attention. SDMA, or Student Diversity and Multicultural Affairs, offers specialized outreach and mentoring programs for students with historically marginalized identities. Be sure to check out their website for all of the different programs upcoming. And they also offer a weekly newsletter that you can join by emailing them. I believe it's diversity@luc.edu. And then finally, Campus Ministry will be listing all of their upcoming events on their website under the Spring 2021 tab. But just a teaser, they're going to be streaming prayer services live on their YouTube channel. Sister Jean, we all know Sister Jean, is going to be offering a residence hall prayer blessing over the residence halls. So that's forthcoming. Make sure to check out their websites. So with all of this information, we know that it's meant to build connection with our students, offset loneliness and other difficulties. But I want to touch on just briefly some potential other difficulties or challenges that may come up for you in the next few months. Experts say that college is a new stage in familial relationships. So you may find that this is a time when you are navigating challenges between yourself and your families. So I really want to encourage you to consider the following discussions. Dr. Morato actually primed me perfectly for this next point, which is to have conversations around expectations, specifically around communication. If this is the first time that you will be separated from your student or from your families, how often are you going to keep in touch? How are you going to keep in touch? So have those conversations beforehand so you know what to expect, what families are expecting, what you are expecting, so that it doesn't come as a big surprise once you're on campus. Health promotion here at Loyola focuses on several topics, but among them more specifically are alcohol and gender-based violence. So I do encourage you to have conversations, as uncomfortable as they may be, with your family around alcohol. Research indicates that families who have these conversations ahead of time, before students really begin their college experience, those students are less likely to engage in high-risk drinking. So for the parents on the webinar tonight, be open about your own experience, but don't glamorize your youth. And then just be honest about what potential consequences you foresee or that you yourself experienced. And then finally, it's really important to talk about consent and healthy relationships. Even in this virtual world, consent is necessary. Respecting boundaries is important. And so it's important to think through and have those conversations again. What does a healthy relationship look like? How does one ask for consent? What does that look like? And if you don't know, don't worry, our office has plenty of educational opportunities to delve into those topics a little bit more. But we also recognize that students coming to campus may have experienced or may experience sexual or relationship violence. I want you to know that it is never your fault and that there are resources available. I am one of 2 trained sexual assault advocates on campus. We see students virtually, but we also have something called The Line. The Line is a confidential, often anonymous resource that students can call and speak to a trained advocate from 8 a.m. to 4:30 p.m., Monday through Friday, and then 24 hours on the weekends when school is in session. The number to call is 773-494-3810. Just know that you are not alone, regardless of what your experience is coming to campus, and we've got you. I want to turn it over to Mary to talk a little bit more about coming to campus and ways to stay connected. Mary?
Thanks, Mira. Hi, everyone. It's so great to be able to talk to you today. So I'm going to talk to you a little bit about how to get connected to the Wellness Center. So in addition to calling us to schedule appointments, there's many ways in this digital age to get connected to the Wellness Center. As you've heard, we're planning to offer a variety of mental health groups, student organization events, and other engaging and fun programming on a variety of health topics. One way to learn about these events is to follow us on social media. So if you would like to follow us on social media, you can follow us at Loyola Wellness Center on Instagram and Facebook. If you're in need of some cute dog content in your lives, we actually have a therapy dog at the Wellness Center. His name's Ashlar. Even though he can't be on campus this semester, we're still going to be posting content on his Instagram at Ashlar the Therapy Dog. We also have a weekly newsletter where you can see our weekly event offerings. We're going to put that link in the Q&A so you can subscribe. We encourage all students to subscribe to the newsletter. Finally, for up-to-date information on Wellness Center medical services like making appointments, mental health services, and health promotion resources like nutrition appointments and student organizations, you can find all of this up-to-date information on our website at luc.edu/wellness. That's luc.edu/wellness. The other thing I wanted to talk to you all about today is Loyola's coronavirus prevention and awareness training. All Loyola students, faculty, and staff are required and expected to complete a 30-minute online coronavirus prevention and awareness training offered by Get Inclusive, which is a leading company in online education. This training was first rolled out by Loyola in August, and it contains important information on COVID-19 risks and risk reduction strategies, as well as more specific Loyola guidelines and resources around COVID-19. We are asking all Loyola students, faculty, and staff who have not yet completed the training to please take and complete it by mid-January, or your access to campus may be restricted. This is part of the return to campus along with testing and the other things that you should do. And it's just also a really important training. I know it's been a few months since the summer, so please reach out if you need information on your training status or you need us to reissue the link. If you are not sure if you completed the training yet and you're a faculty or staff member, please email human resources at hr-training@luc.edu. If you're a student and you want to know if you finished or you need the link, email covid-training@luc.edu. If you're a transfer or a spring admit student or a new faculty and staff member and you haven't received the link to take the training yet, don't worry, that link should be coming pretty shortly in the coming weeks. So if you are starting in the spring, you'll get that link shortly, and that will also be due in mid-January. If you have any questions about that, please reach out to the emails that I indicated for students and for faculty staff. And then I just want to say that this training, I found it really helpful. I know we've all heard a lot of information about COVID-19, but this one is really rooted in CDC and other reputable health information, and it's informative and just will really give you a good background, especially if you're planning to be on one of our campuses this spring semester. Thank you so much.
Yeah. Thank you, Mary. Thank you, Mira. I know Mira's getting back on. I just want to say I took the training and I found it really reaffirming. We get a lot of this in the news and it's hard not to get fatigued by it. And I thought the training was just really great and just reminding us the quick highlights of all the things that we need to be doing collectively. So I thought it was actually, as training goes, rather fun. So I know we focused this evening largely because we're reopening campuses in the residence hall. You provide a lot of really great information that's focused on health promotion and probably more of an undergraduate audience. So I want everyone listening to know or to remind you that there will be a student experience webinar in early January, January 6th. And that particular webinar is going to go into a much more detail and all of the health or promotion kinds of activities that the university is doing for all students, both undergraduate and graduate, and for all campuses. But I'm wondering, Mary and Mira, if there's any highlights or top notes, if you might say, if there's a graduate student that happens to be listening here, things that you have in the works.
Yeah, absolutely. First, hello, graduate students. Thank you for being on the webinar if you are here. I want to point out, if you don't already know, that there is a whole department dedicated just to graduate professional and adult students. We often partner with the director, her name is Astrid, to do joint programming. Just around the election, we offered a discussion around potential election outcomes that was specific for graduate, adult, and professional students. So we are often partnering with that department. I mentioned study day earlier in my remarks, but every year when we are in person, we offer study day activities down at the Water Tower campus. So we do try to make our activities available for both. What I will say is that if you want to stay most current to what is being offered there, there is a graduate, professional, and adult student newsletter. So that should be coming out in the chat as a way to subscribe and to know all of the different resources that will be available to you.
That's great. And if you want to know more, also come back January 6th. So the question I'll ask you both then is a follow-up to the thread we were discussing earlier with some of the panel members, and that is around how do we deal with concerns around isolation and lack of fresh air, ability to socialize and connection. You know, how are you all thinking about how we balance the necessary precautions with also these concerns as we think about health promotion?
Mm-hmm. Mary, do you want to take that, or you want me to take it?
Sure. I could start, and then you. So I think that we just really want students to know that even though you know, everything is really virtual right now and it's not the same as the past, we are, you know, still a Loyola community, and we want everyone to feel like they are connected. And especially in health promotion, we're really trying to offer just a lot of different experiences for students. I think Mira had mentioned we have a few student organizations within the Wellness Center. We have one on positive body image, one on peer health education, and one on gender-based violence prevention. And being part of, you know, students can join those organizations. And then also all the mental health groups that we have. We just encourage students to attend those to really, especially during move-in quarantine, just to really be connected to students and just kind of get a break from where they are. And then Mira, you can add to that.
Sure, I'm happy to. I think with a public health background, my first love is always prevention. And so if you find that there's something that's working for you at home, it's likely to work for you on campus too. So while it's going to be 2 weeks where you're going to be limited in your activities, just because we are separated doesn't mean that we're alone. So be proactive about reaching out to your support system. Reach out if you do have a history of working with a therapist. Get connected with us early so that you have those structures in place when you arrive on campus. And it's not the same. I know that it's not the same to hang out with your friends on Zoom, but I know that I personally get off Zoom calls sometimes with friends and I feel replenished. So just know that it's a small period of time where we all have to do this together. But there are ways to stay connected. There are ways to be involved and just to be proactive about it before you start to feel sort of lonely or feel like it's too late, because it's never too late. As I said earlier, we've got you. We've got resources for you. Just reach out.
Right. And just to underscore what you said, as well as David said, you know, have a plan for yourself, right? I mean, it's all about tailoring a plan that makes the most sense for you and what you enjoy. I know my plan is I do online virtual yoga, so that's part of my wellness plan. So thank you very much for sharing all of the wonderful information that's available to students at Loyola. It's now my pleasure to close our discussion, and we get to listen from a student perspective. We're delighted to have Rahima Siddiqui. She's the class of 2021, almost graduated. She's in the College of Arts and Sciences, but she's also the Chief Health and Wellness Officer for Student Government. And so she is generous with her time. It's finals time, and she's willing to be here to provide and share some of her perspectives as well. Rahima?
Thank you, Dr. Morado. Hi, everyone. My name is Rahima Siddiqui, and I serve as the Chief Health and Wellness Officer of the Student Government of Loyola Chicago. So the SGLC is a representative body, and we serve as a voice for the undergraduate students at Loyola. We've been fortunate enough to work with the Wellness Center over the years to do things like advocating for mental health resources and services throughout the university. I know it's a little early to be getting sentimental, but the people I met through SGLC and the people I befriended through it have been one of my biggest support systems in Loyola since my freshman year, and I'm proud to be working with some of the most passionate and dedicated students I know. So this year, I'm also a senior, and I am studying global and international studies. I'm just one semester away from graduation, so of course, graduating in less than 6 months is going to be a little tougher than I anticipated. I think I can echo the concerns of several of my friends that are also senior when I say that things like leaving college, finding a job, moving away from campus, all of that in the middle of the turmoil that has come with COVID-19 is very anxiety-inducing. So with that, I think one of the most important things for me was coming to terms with the fact that I will not be ending my college career the way that I'd planned. Everyone that knows me knows that I'm a chronic planner and I can't last more than a few hours without my calendar. So you can imagine that was a hard pill to swallow. I love making 3-year plans, 5-year plans, meticulously outlining when I want to get things done. But if this pandemic has taught me anything, it's that our plans are at the mercy of unimaginable things, such as a global outbreak. So while I know how it feels to be giving up milestones, like walking the stage at graduation and sharing that moment with my extended family across the country, I can't even begin to imagine what this looks like for freshmen, for the first years and their parents who miss things like high school graduations, college move-in day, freshman socials, all in the span of a few months. One of the highlights personally of my first 3 years of college was sitting for hours in the student center in the library, setting up camp in Damon and the IC with my friends, pretending to do our homework and taking snack breaks every few minutes. And it's my hope that the current freshmen and the incoming ones will be able to create those same memories in time with their friends. As the Chief Health and Wellness Officer of SGLC, my role is twofold. The first being to talk to students, and the second being to share those concerns, ideas, and questions with administrators. And so, of course, at the forefront of those questions this semester has been student mental health. So I'm going to speak frankly here. This semester has been rough for all of us. Sitting in front of a computer for 16 credits of classes is draining, especially when I have a boatload of asynchronous homework and offline assignments to complete as well. I know at one point this semester, I found myself with nearly a dozen recorded lectures piled up because that particular week just became too overwhelming. It's been hard to focus on school, especially when I have the news open on another tab that's telling me that another 3,100 Americans have died that day, putting us on track for 300,000 deaths by the end of the year. It's hard to be a college student when you're also anxious about your own health and about the health of your friends and family and loved ones. It's hard to be a college student when you're also trying to participate in the fight for social and structural change in our communities and our country. It's hard to be a college student when you're also struggling to pay the bills because you've lost your only source of stable income during the school year. And lastly, it's hard to be a college student when in the middle of a 1-hour Zoom lecture with 80 other students, we're all still feeling the loneliness and isolation that has come with this pandemic. And this pandemic is frustrating too, especially when the national and state and local guidelines seem to be changing with the drop of a hat. I know how disappointing it is to be spending holidays and milestones away from your family, especially when you look outside and it doesn't seem like everyone seems to be using that same level of caution. So even if a large fraction of the world stays at home and wears a mask and social distances and does all the things that we've been told to by our state and local officials, that'll make a difference, certainly, but this pandemic won't be over without the cooperation of every single person in our communities. So with that, I want to reiterate what we all heard earlier today, which is to reach out to your support systems. It can exist among your classmates, your RAs, the Wellness Center, SDMA, SAGA, campus ministry, all around the university. And it can exist outside of Loyola too, with people such as your roommates, your family, and your closest friends. Let today be your sign to reach out and lean on the support system that you feel most comfortable with. So for many of us, next semester, spring 2021 is also going to be mostly online. And even for those with a few hours on campus for classes or for other activities, it's still going to be a little difficult. For me, one of the most useful tools was definitely setting boundaries between my workspace and a relaxation space, even if it's just making sure I don't bring my homework the few feet away from my kitchen and into my sleeping area in my apartment. I know it's hard to take a screen break when everything seems to rely on your laptop or your desktop. I know I'm guilty of going straight from my laptop to my phone, spend a few more hours on there, but I promise that looking away and taking a walk or reading a book helps so much in giving yourself that break. Setting boundaries where you can and when you can be instrumental in easing the burnout that I know many of us are feeling. I'm feeling it and I know my friends are too, so I'm right there with y'all when I say that spending hours with technology and without a break is incredibly tough. This year will probably go down as one of the most historic years for many reasons. And while that brings all sorts of stress and anxiety with that title, use this time to celebrate your wins. You made it this far, and for some of you in 1 week, you will have survived your first batch of college finals. And for some of the seniors graduating this winter, this will be the last. This can be the year you discovered new hobbies and passions, whether that's things like filming TikToks or hosting game nights on Zoom. This can be the year you discovered new ways to embrace mindfulness and self-care. This can be the year you took that step and reached out to the Wellness Center for help for the first time. So with all of that, please look out for yourselves, for others, and for your community, and let this pandemic serve as a lifelong example of our strength and resilience, even when we are apart. Thank you.
Thank you very much, Rahima. I loved listening to the words that you had to say. And you know, some days it's just, let's just say it, a pandemic's no fun, and this is really tough. And hearing students, you know, this is not necessarily what you envisioned for your senior year. Oh, my video I thought was on. Thank you for reminding me. You know, it's tough, and it's not what you envisioned. I know for your senior year, I know for freshmen, it's not what you envisioned college would be like. And I know for our sophomores and juniors as well, it's tough. But I'm inspired by your resilience and finding a path forward. And that's what we're trying to do collectively as a One Loyola community, is find our path forward together and support. And as we continue to gradually reopen, provide that environment that allows more student connection in a safe way. And so now's our time to close the evening. I want to point, a few folks are asking still where you can find links to some of the information that some of our panelists are saying. If you go to the bottom of your screen where the Zoom webinar is, there in the middle is a little chat box. If you click on that, there have been a series of links and information that's been in that chat that you can click directly and look for those resources. So that's one way that you can get information right away. I want to remind everyone also that we will be staying on after the panelist presentation to continue to answer in the Q&A section questions that are still coming in. I see that we have about 4 open questions and we've answered 248. So we're here to make sure your questions are answered. And I hope that you heard information that was helpful for your own decision making. So thank you very much for your time and attention today. Thank you, Rahima, for sharing your experiences and insights with us. I know you and other student government leaders are key in making this work and have been actively working with university, faculty, and staff to make plans that make sense and are appropriate for our student experience. So with that now, I'll say goodnight and turn it over for final words from Dr. Joan Holden. Thank you.
Thank you, Dr. Morato, and thanks to all of you for connecting with us tonight. And thank you so much for all the questions that you've submitted. We appreciate your engagement, and we are indeed, all of us, in this together. My appreciation extends to those of us tonight, but also our moderator, other panelists, and our team answering questions for sharing their time and expertise and for their leadership as we care for our students in our community. Please do stay connected and in touch with the latest information through our COVID-19 and Return to Campus websites. The URLs will be on the closing slides. And as mentioned, we invite you to more webinars in the coming weeks that cover topics related to student academics, the student experience, and residence life. Please stay safe and healthy and keep taking care of each other. Good night.